Dietary management of obesity, coronary heart disease, and diabetes mellitus. Lifestyle diseases increasingly appear, which include arthritis, asthma, some kind of cancer, diabetes, heart disease, depression, and obesity. The key to achieving and maintaining a healthy lifestyle is not about short term dietary changes. It's about a lifestyle that includes healthy eating and regular physical activity and balancing the number of calories you consume with the number of calories your body uses. Staying in control of your weight contributes to good health now as you age. In this lecture, we are going to discuss about the different diseases like obesity, heart disease, and diabetes mellitus. What do you understand by the term obesity? Obesity is a term that is used to describe somebody who is very overweight with a high degree of body fat. Obesity has become a worldwide health issue. The majority of people are either overweight or obese. It increases risk of diseases and health problems such as heart disease, diabetes, and high blood pressure. Dietary management. Dietary management, also known as food service management, it is the practice of providing nutritional options for individuals and groups with diet concern through supervision of food services. Dietary management of obesity is to lose weight by decreasing energy intake to achieve an energy deficit that can be sustained for a sufficient period. A 5 to 10% weight loss over 3 to 6 months period has a massive health benefit. Now, let us study the various steps for the dietary management of obesity. Decreasing energy for weight loss. Consuming food low in energy density decreases energy intake over several days, but the effectiveness of this strategy for weight loss has not been tested. Reducing dietary energy density, particularly by combining increased fruits and vegetable intake with decreased fat intake, is an effective strategy for managing body weight while controlling hunger. People who eat a healthy breakfast tend to find it easier to control their weight, and eating healthy snacks can help to reduce overeating and meal times. The easiest way to reduce dietary energy density is to reduce fat intake. Reducing intake of sugar rich and alcoholic drinks is also a useful strategy for reducing energy intake. Very low calorie diet. A very low calorie diet is not just a diet that is low in calories, it is a special type of diet that replaces all of your meals with prepared formulas, often in the form of liquid shakes. A low calorie diet is used for a short time to promote quick weight loss among some people who are considered to be obese. The diet requires close care from your doctor and is usually combined with other ways to lose weight. It should only be undertaken after seeking medical advice and under supervision. However, this method can be effective in well motivated individuals. Weight loss maintenance. Developing long lasting food habit is very difficult, and recent weight losers are at high risk of weight regain. There is a general perception that almost no one succeeds in long term maintenance of weight loss. To maintain weight loss, engaging in high level of physical activity, eating a low calorie, low fat diet, eating breakfast regularly, self monitoring weight. According to recent study, participants who lost weight faster were more likely to achieve their target weight loss. Once desired weight loss is achieved, individuals need to make intensive effort to maintain their lost weight. Maintaining a balanced diet. Healthy eating is not about strict dietary limitation, staying unrealistically thin, or depriving yourself of the food you love. Rather, it's about feeling great and having more energy and stabilizing your mood. The following tips apply to dietary management of obesity, although the energy density of the overall diet will be different. Start the day with a healthy breakfast. Eat regular balanced meal. Aim to include at least 5 portions of fruits and vegetables. Choose foods and drink that low in fat and sugar. Avoid eating at the same time as doing something else, that is watching TV, working or reading. Wait at least 5 to 10 minutes after eating before you decide you need more. It takes time for your brain to know your stomach is full. Now, moving further, we will discuss about the coronary heart disease. Coronary heart disease is a disease in which a waxy substance called plaque builds up inside the coronary arteries. These arteries supply oxygen-rich blood to your heart muscle, and there is no single cause for coronary heart disease, but there are risk factors that increase your chance of developing it. Now, let us go through the causes of coronary heart disease. Heart disease is caused by buildup of fatty acid inside your artery wall. It is common in men after 45 years and women after 55 years. The causes are smoking, high level of certain fats and cholesterol in the blood, high blood pressure, high level of sugar in the blood due to insulin resistant external link icon, blood vessel inflammation. What are the signs and symptoms of heart disease? The disease might not be diagnosed until a person has a high sign of symptoms of a heart attack or an irregular heartbeat. Signs of heart disease are heart attack and heart failure. First, we are going to cover the problem caused by heart attack. Heart attack is a serious medical emergency in which the supply of blood to the heart is suddenly blocked, usually by a blood clot. A heart attack occurs if the flow of oxygen-rich blood to a section of heart muscle is cut off. If a clot becomes large enough, it can mostly or completely block blood flow through a coronary artery. Lack of blood to the heart can seriously damage the heart muscle. If the blockage is not treated quickly, the portion of heart muscle fed up by the artery and begins to die. Symptoms can include chest pain, shortness of breath, feeling weak, and overwhelming or feeling of anxiety. Second sign is heart failure. Heart failure does not mean the heart has stopped working. Rather, it means that heart is pumping power is weaker than normal. With heart failure, blood moves through the heart and body at a slower rate, and pressure in the heart increases. The most common sign and symptom of heart failure are shortness of breath or trouble breathing, fatigue and swelling of ankles, feet, legs, stomach. All of these symptoms are the result of fluid buildup in your body. When symptoms start, you may feel tired and short of breath after routine physical effort like climbing stairs. A famous quote by Vinnie Jones, awareness about heart disease has got to be raised. Now there are different points which discuss about that how to prevent heart disease. Lifestyle changes. Making lifestyle changes often can help to prevent heart disease. Lifestyle changes might be the only treatment that some people need. Follow a healthy diet. A healthy diet is an important part of a healthy lifestyle. Following a healthy diet can prevent or reduce high blood pressure or high blood cholesterol. Dietary approaches to stop hypertension. Doctor may recommend to eat if you have the problem of high blood pressure, and it focuses on fruits, vegetable, whole grain food that are heart healthy and low in fat. Be physically active. Routine physically active can lower heart disease risk factor and bad cholesterol, high blood pressure. Physical activity also can lower risk. The more active you are, the more you will get benefit. Quit smoking. If you smoke, then quit it. Smoking can raise your risk of heart disease and heart attack. Talk with your doctor about programs and products that can help you to quit smoking. Manage stress. Research shows that the most cases for a heart attack is an emotionally upsetting event, particularly one involving anger, and having supporting people in your life with whom you can share your feelings that can help to relieve stress. Now we'll discuss about the diabetes mellitus. Diabetes mellitus, also known as simply diabetes. It is a group of metabolic disease in which there are high blood sugar level over a prolonged period. Diabetes as a diabetes mellitus describe a group of metabolic disease in which the person has a high blood glucose because of insulin production is inadequate. Patients with high blood sugar will typically experience frequent urination, and they will become increasingly thirsty and hungry. Now, let us discuss the types of diabetes. Type 1 diabetes, the body does not produce insulin. People usually develop this type of diabetes before their 40 years. Often in early adulthood or teenage year, patients with type 1 diabetes will need to take insulin injection for the rest of their life. Type 2 diabetes, people able to control type 2 diabetes by losing weight, following a healthy diet, doing plenty of physical exercise. And however, this type of diabetes are typically a progressive disease. It gradually gets worse and the patient will probably end up to have to take insulin or usually in tablet form. Gestational diabetes. This type affect the female during pregnancy. Some women have very high level of glucose in their blood. Their bodies are unable to produce enough insulin to transport all of the glucose into their cells and resulting in progressively rising level of glucose. The majority of gestational diabetic patients can control their diabetes with exercise and diet. How to control diabetes? Current and potential opportunity for the prevention of diabetes mellitus and the improvement of projection through the early detection and treatment of complication. Diabetes type 1 lasts a lifetime and there is no known cure. But type 2 usually lasts a lifetime. However, some people have managed to get rid of their symptom without medication through a combination of exercise, diet and body weight control. Patients with diabetes type 1 are treated with regular insulin injection. Patients with type 2 diabetes are usually treated with tablets, exercise and special diet. Diabetes prevention is as basic as eating more healthy fully, becoming more physically active and losing extra pounds. And making a few simple changes in your lifestyle now may help to avoid serious health complications of diabetes such as nerve, kidney and heart damage. Consider the latest diabetes prevention tips from the American Diabetes Association. Active smoking is also associated with an increased risk of diabetes, so the discontinuance of smoking can be an important preventive measure as well. If diabetes is not adequately controlled, the patient has significantly have a high risk of developing complication. In this lecture, we discuss about the dietary management of obesity, coronary heart disease and diabetics. However, this knowledge have widened the understanding of individual about these serious diseases and its prevention. Thank you.